Live, local, late-breaking. This is KEZI 9 News, breaking news.
Good morning, I'm Brian Anderson. Lane County Public Health is holding its daily press conference right now on the status of the coronavirus in our area. This morning, reporter Emma Jerome is at the health department monitoring that briefing getting underway right now. Let's take a listen.
And then have that feed available for media. So we're going to try it out today, work out any kinks, and then hopefully going forward, we don't have to have all of you in the same room because we want you healthy too. Today we have gathered our first responder and law enforcement community together to have their messages heard by the community and talk a little bit about their response and what they're doing, as well as some exposures that have happened and what's being followed up on those. So with us today we have Eugene Springfield Fire Chief Chris HEPPEL, City of Springfield Police Chief Richard Lewis, City of Eugene Police Chief Chris Skinner, and Lane County Sheriff Cliff HARROLD. And at this time, I will call Eugene Springfield Fire Chief Chris HEPPEL up to the mics, and he can talk a little bit about what's going on.
Good morning, thank you for coming. I'm Chris HEPPEL, Fire Chief for Eugene Springfield Fire. And we know our community values our first responders, and their health and safety is certainly one of our top priorities. There are a number of measures that we have in place for our public safety folks, especially our fire and emergency medical services team, because we recognize that we're a critical asset to continually protect our community regardless of the environment in which we're operating in. Some of our protections we look at are things such as protocols, training, and we practice these things on a regular basis. Our first responders have standard environmental infection control procedures, which we train on annually, and we practice daily, day in and day out. We also receive training on how to work with patients safely, and it starts actually before we arrive with pre-arrival information from our 911 center, and then that information continues on through in our practices all the way up until we transfer patient care at the hospital if it's necessary for us to transfer those patients. Proper protective equipment is another piece. Crews have been and will continue to exercise increased vigilance with regards to wearing appropriate personal protective equipment when responding to calls where flu-like symptoms are present. And we actually implemented those practices back in November. And the reason is because we go through flu season annually. And when we start to see an increase in flu-like symptoms in our calls, or we start to see individuals with fevers that come from an unknown source, we actually implement what we call our flu card at the 911 center. And what that is a series of additional questions that we ask the callers. Are there flu-like symptoms? Does anybody have a fever, etc.? We then tell our first responders who are en route to that call that there's flu-like symptoms present, which give them a heads up to make sure they're properly prepared before entering that environment. As you know, Eugene Springfield Fire was notified on Tuesday night of the potential exposure of 9 crew members related to the recent death of an individual who later tested positive for COVID-19 in Lane County. Certainly our heartfelt condolences go out to the friends and family members of that patient. The involved responders were contacted by our staff and self-isolated while an exposure investigation was conducted by Lane County Public Health as well as our own infection control officer. So I'll give you an example. When we were notified, we immediately determined who were the individuals on that scene. In coordination with our infection control officer, we made those calls to those individuals in less than an hour. They all chose to self-isolate at home. And then yesterday morning, in less than 12 hours, we started that investigation process. Again, one was done by our infection control officer, the other was completed by Lane County. Some considerations when we're doing these dual investigations, which we intentionally have done separately, are to investigate and take into consideration the proximity of the individuals to the affected patient, the duration of time we spent with that patient, the personal protective equipment that's worn by responders, and the procedures that were performed to resuscitate this particular patient. The call did come in on Saturday night as a cardiac arrest. Based on the investigation, following CDC guidelines, and in cooperation with Lane County Public Health, Eugene Springfield Fire's Infection Control Officer, as well as our labor groups, we found that 6 of the crew members were classified as a low exposure. And following those guidelines, that actually allows us to continue monitoring those 6 individuals. However, they are allowed to go back to work, and they have been released back to work. We had 3 individuals that were in the next category up. And taking a bit of a conservative response to that, we left those 3 individuals in isolation. The period of time is still yet to be determined, and the reason for that is because the incident occurred on the 14th. We were notified 3 days later, so many times we refer to that as the time might be shortened because they were exposed on the 14th. So we'll look more into that. It's important for the community to know that this event will not impact emergency service delivery for Eugene Springfield Fire. Now, while we have 3 individuals, we manage almost 250 personnel on the line that provide daily direct services over 3 shifts. So we can easily, at this time, we can easily fluctuate our service delivery and the staffing challenge. Now, if it continues to deteriorate or we have other pieces, then what we will do is we have established alternative delivery models. But as a whole today, the Eugene Springfield Fire is strong, vigilant, well prepared, and ready to continue to deliver service to our community regardless of the direction that this incident goes.
Just going to be doing some light cleaning here while we observe all safety protocol.
Good morning. Chief Richard Lewis, Springfield Police Department. And I think what I want to talk about today is just to assure the citizens that when you pick up the phone and call 911, you're going to get a police response. You're going to get the police response like you have for the last 20 or 30 years. And we have the protective measures in place for our officers. They've been given the proper protective equipment. So if they do come into a situation they need to don this, they'll put that on. But people have questions about, they hear there's a reduction in service. You might see a slight reduction in some crimes that are very at a low level. We may do that by phone if there's non-suspect information. But for emergency calls for service, you're going to get a police response. And that's really important to us. Public safety is the #1 for us. We are here to provide that public safety. It hasn't changed because of this situation. It will continue to be just as it has been. We will come up with the necessary resources we need if there's a problem. We have staffing plans in place. We don't have any staffing issues at this time. We've been very fortunate for that. And so I just want to assure people that when you call 911, you're going to get a police response and an immediate police response. I want to talk a little bit about our jail. We've changed a couple of our procedures in our jail just to address the situation. One of those procedures is prior to an inmate coming into the facility, we're having our medical staff go out and actually monitor the individual out into the sally port before they enter our facility and make a determination at that point. We also are having our medical staff check each and every inmate we have housed in our facility every day to make sure that we don't have any issues there. And again, our personnel have the protective gear they need. And additionally, we're adding we clean the jail a lot. We're going to clean it even more during this certain time. And I just want people to be, you call the police department, you get a response. The only other issue you're going to see is we're limiting our access to our lobby. There's a phone number to call out there. It's not that we won't let people in because we want people to come in that need to be in the lobby. But if the question can be answered outside or on the phone without coming inside, we want to be able to do that just to limit the access. Thank you.
Good morning to everybody. Thanks for showing up and being a conduit of information for our community, which I think is really important in this time of anxiety and uncertainness. We talk a lot about crisis in our world, and oftentimes the crisis that we deal with have a beginning date and a middle date and an end date, and we can plan for that end date and how we're going to recover from those things when the crisis is over. This is a little bit unique in the sense that we're just not quite sure when it's going to end. And I know that that creates a ton of uncertainty for our community. And when we have this much uncertainty and this much anxiety, one of the things that our community members need so desperately is to know that their emergency personnel and emergency services are at the ready and stand ready to be able to serve them in any way that they can. The Eugene Police Department very early on took some preventative measures in shutting down our police department to outside visitors and non-essential staff, community meetings, those types of things, both in the police department and at our dispatch center. That's one of the pieces that we often forget to talk about, is that our call takers and dispatchers, the health of those first responders is so important. And that we have people on the other end of the line when you call, whether it's non-emergency 911 or 911, that we have those individuals ready to take your calls. And so we've shut that area down to non-essential personnel and visitors and not hosting any meetings there. We've talked about what social distancing means in our workplaces and in around the dispatch center and in our environment and law enforcement. And we've provided opportunities for non-essential staff to work from home where applicable. But make no mistake, we've identified who our essential staff is, and that's our 911 dispatchers and our police officers. They're at work, they're answering calls for service, and they're ready to serve this community as robustly as they always have. And in fact, because we've been able to pull some police officers back from other assignments as those assignments have been held or put on pause, we're better staffed today than we've ever been staffed to be out on the road and answer calls for service. Now, keep in mind that officers will have discretion on whether or not they do policing from a distance, and that might be a phone call where you would have seen them in person. That might be a phone call instead. It might mean taking some added discretion on what we enforce with an arrest versus a citation in lieu of custody. And we want to be great partners and understand that our jails, both in Springfield and Lane County, are managing their population very, very closely. And we don't want to be a contributing factor to that, but we also know it's important to still hold people accountable for bad behavior. Our call volume is steady. There's not been a decrease in call volume for the city of Eugene, so we are not noticing a decline in that. We are noticing fewer cars on the road, but what we're noticing is we're noticing more bad driving behavior on the road and are enforcing that. As we all get frustrated with the construction on 105 and our on-ramps and off-ramps being shut down, I'm just asking people to be good citizens and good community members and just slow down, be mindful, and just be respectful as we're on our roadways. We've noticed that our stores and our retail chains, the supplies are limited, if not gone right now. We know the supply chains are still fairly healthy, and we'll be getting more of those things into the stores. The challenge is having staff to stock the shelves, and we'll continue to monitor in the EOC how that's happening. One of the biggest challenges through that, as I'm told through the EOC, is the hoarding behavior that we're seeing from citizens, where we're taking more than we actually really need. And we're just asking people, again, to be good stewards of that, respectful, good citizens, and understand that when we do that, it creates conflict, and sometimes conflict adds an undue burden on the criminal justice system and law enforcement response. So in closing, I would just say that your police department in the city of Eugene is ready to continue to serve. We're finding creative ways to be able to do that. We're finding creative ways to engage with our homeless population as we continue to see calls come in around concerns with them. And we will make sure that we communicate early and often on any adjustments that we're going to make to police services. So thank you.
Good morning, and thanks again for being here, Sheriff Cliff Harrold. I really want to say thank you to you all in the community for caring about the first responders and wanting to know how they're doing. I think the fact that the community recognizes their role and wants to know how they're doing says a lot about the community we live in, and I appreciate it. So, at the Sheriff's Office, our mission is to conserve the peace, and one of our stated core values is honored to serve. And so we use that mission statement and our core values to make decisions during times like this on how we're going to respond to the unusual circumstance that we're in. It's my conviction in the Sheriff's Office, and what you've already heard from my partners up here, that our highest priority is to be that visible representation of stability in our community at this time where the community is experiencing a lot more anxiety than normal. And we're going to continue to calmly provide the essential services that we do to the community. We have made, obviously, some adjustments to the times that we're in. From a patrol perspective, you've already heard about those really from both of the chiefs of the municipal police agencies, and our patrol is no different. We have the proper PPE that we need when we respond to calls. We'll continue to respond to the calls in the same fashion that we always do. Of course, for the sheriff's office, that is longer response times and predominantly for in-progress person crimes, life safety things. But not a lot of changes there, and our staffing is unchanged at this point. Within the jail, we have 24/7 medical services within the Lane County Jail. And I'm very pleased that our medical provider has really, over the last couple of years, established a great working relationship with public health on a number of day-to-day issues that public health works on outside of this unusual event. And so that foundation and relationship has really benefited us greatly during this time. Lines of communication between our jail medical and public health are easy and open. And so while we have made some adjustments, we haven't made a ton. As I said, we've got the 24/7 medical in the jail. We have an RN and have had, it's not specific to this incident, but we have a registered nurse in our booking area to do evaluations on everybody that gets brought to jail as standard protocol. And so that's unchanged. We'll continue to do that, and that involves all the vitals, including temperature. And if we identify anybody that's displaying symptoms, then we'll isolate them and we'll take all the proper protection protocols. So as Chief Lewis mentioned, with the Springfield Municipal Jail, we've upped our cleaning schedule. We work pretty hard to keep the jail clean anyway, but we're being even more timely on that. As an example, after every book-in, we'll clean the entire space where the individual is booked in prior to the next book-in. And so we have that in place. We've made some changes to visiting, and so for those that are unfamiliar, the attorneys in our community that represent the people who are in our jail, they frequently come to our jail to visit with their clients, and typically that's in a visitation room where they're both present in the same room. And so we've shut down that, but we've created an alternative way for the attorneys to be able to communicate with their clients and not be locked in a small room with them. So we've got that in place already, and then we've made some slight adjustments to social visiting. So rather than 3 family members per individual that's incarcerated being able to come visit, we've limited that to 1. So that limits the number of people that are waiting in that visiting area to do visiting. We've also worked with the provider of the phone services within the jail, and they are now providing weekly free video conferencing with the individual that's in custody. So that's a service that normally costs the families some money to be able to video conference with a person in custody. But the phone provider is offering a weekly free video conference for each person in custody. So again, reducing the number of people coming into the facility. And then we have some slight adjustments in our main office services. So when we have the public coming in for court paperwork or fingerprinting or concealed handgun licensing, and I think the shortest version of the adjustments is we really ask you to call first so that we can talk about what the services that you're looking for and give you guidance. We have a lot of services that are available online as well, public records requests and those sorts of things. And so those are pretty easy to find on our website. We have the main phone number to call on our website. Give us a call and we'll tell you if we're able to facilitate your request or not. We've maintained at this point our normal business hours. But again, we're just asking you not to show up in person. Give us a call and we'll provide guidance from there. Yeah, I think that's the basics of the adjustments we've made. I just want to end on, again, this idea. I mentioned one of our core values is honored to serve. And I can tell you from 3 decades of being in the business in Lane County, all of my partners here and the law enforcement agencies and first responders who aren't represented right now, I believe we all employ people who take that honored to serve. I think that the people that we hire are people who are internally driven to serve their community, and that they are honored to serve day in and day out, and in particular in times like this where they see that their community is in an anxious state, they're honored to serve. And we in Lane County should really appreciate the fact that we've got a bunch of great first responders. Thank you.
In an effort to keep our distance and make sure that we're following all public health guidelines, I will now take questions. So we'll do them one at a time. This will be slow, but we'll just go ahead and state the question, and then we'll call up the respective agency that the question is directed to, and then they can answer. I will be restating the question for those people watching. We had that request come in so that people can understand what the actual question is. So who wants to go first?
Jason, question for you. Governor Brown announced, I think, a contract for 20,000 testing opportunities, not kits, 5,000 readily available. Do we know how that could affect Lane County?
Let's save those questions for my situational update that I will do after our first responders. We want to get them back to their offices as soon as possible. So let's have first responder questions first,
Okay.
and then we'll move on to that.
I have one for Chief HEPPEL.
All right, Chief HEPPEL.
Okay. Curious if you could expand on PPE for first responders going into, where the flu or coronavirus might be. And then secondly, if you could comment on the 3 that are in quarantine, if they're doing healthy or doing all right.
Sure. So the first one is PPE utilization. So as I mentioned in my presentation or briefing, it actually starts with a 911 call and our first responders and that piece. So that allows us to be prepared to go in. The next piece that you'll see is a little bit of a interaction difference that we have. So it's very common that we just would simply walk into someone's home or their living room, take care of what their need is, and then transport them, provide guidance, etc. Some of our behavioral changes are simply we would probably stop at the door and see what's the scene look like. Can the patient potentially or the person who called come outside? We would place a mask on them. Our first responders, you'll see us wearing 4 particular items. One is you'll see us wearing eye protection that has a wraparound component to it. You'll see us wear some type of a mask. You'll also see us wear gloves, which we do almost every day on almost all of our calls. And then you might see a gown as well. So depending on the type of call will determine the level of protection that's needed. And if our indication is a higher level of protection is needed, the crews are trained and equipped to implement that level as need be. Your second question was if the 3 crew members at home. They are at home with their families. They've chosen to be isolated at home with their folks. At this time, none of them are showing any signs or symptoms.
Thank you.
I have a question. There has been no talk of a shutdown for our city, but if we edge to something similar, what does that look like? Will there be people patrolling the streets? What is the sort of protocol that we can expect if we're going to edge to anything like that?
So I'll speak specifically to fire and emergency medical services, and our response is not going to change. So we are staffed 24/7 across both cities and the 7 contract districts that we serve. We have 16 fire stations open 24/7. We will continue to staff those going into the future regardless of what that environment looks like. What might change is our deployment to that. So scene safety and the safety of our responders needs to be number 1 in those particular instances, and the reason being is if we're not healthy and safe, we can't respond to the needs of the community. So that's how we will respond as the fire and EMS services.
Just wondering, with this situation where 3 first responders were potentially exposed, is there something you're going to do different going forward from this particular incident that we should know about?
So this particular incident was called in and dispatched as a cardiac arrest. And so when those situations are very fluid, there's a lot of emotion, there's a lot of procedures that need to be done. However, in our particular system, we are very choreographed when it comes to that piece. So where this particular call was potentially a success story was the first crews got in there. They had no idea that this could be a potentially COVID patient or had flu-like symptoms. But as soon as they did and recognized those who were coming, they notified, said, hey, make sure you're properly geared up, et cetera. Those folks were exposed for a very short period of time, and they got in their equipment within minutes. But we can only go with the information that we have. The other piece with that is you could ask the question, well, why don't we just wear PPE on every single call? And the answer is we have a limited supply. So we really need to have an appropriate response to these different calls, and we need to utilize our resources in an appropriate way. And about keeping the safety of our responders in the community in place. But for us, this is a lot of our normal procedures because we deal with flu-like symptoms during flu in the exact same manner.
Before we let you go, could you run through the timeline with that 9-person crew in terms of how that went down, that the test came back, and then you alerted the crew, and then it sounds like there was a recent reevaluation of that just led to 3. Could you just walk through how that went down?
Sure. We were notified approximately 2000 hours by Lane County Public Health. I then contacted our infection control officer, who then went through our schedule to see a couple of things. One, who was on the call. And then once we identified those individuals, then we also looked at, had they come back and been on shift? It had already been a couple of days. Had they gone and taught classes with you in the organization? What other interactions that they had, along with their contact information? We were able to collect that very quickly, and then we submitted that information to Public Health so they could start their investigative piece. Within an hour of us receiving and collecting the information and determining who it was and where they were, we started notifying those responders. All 9 of them elected to stay at home that evening. None of them were on shift at the time. Many were scheduled to come on to shift yesterday morning. I contacted our on-duty battalion chiefs, and at about 10 o'clock on Tuesday evening, we started working coverage to ensure that there was no degradation in service whatsoever to the community, with those 9 crew members not showing up to work on Tuesday morning. On Tuesday morning, Lane County Public Health reached out through their investigative team to those 9 responders. They started their investigative process while our infection control officer began her investigative process. Later in the afternoon, it was after 5 o'clock, those teams came together, had the discussion as to what their findings were. We categorized them following CDC guidelines, and then as a team, which involved myself, our infection control officer, our supervising physician, our labor group, as well as Lane County Public Health, made the determinant on what the disposition of those folks would be. In the end, 6 were allowed to return back to shift, and then we have our 3 who are safely at home with their families.
When the call originally came in, this person was experiencing symptoms of cardiac arrest. Was there any indication that they were also experiencing symptoms of COVID-19, or was there just none of that?
I can't speak to that specifically. I haven't reviewed any tapes or the patient care report.
Thank you.
Okay. All right, and I believe that KZI's question was directed at all of you. Is there any other first responders or law enforcement that would like to also respond about that question? No, I'll respond. Great, sure.
Again, Chief Skinner with Eugene Police Department. I think it's important I think in all of our worlds in law enforcement, we recognize that in times of crisis, there are people that are lying in wait to take advantage of that. And that we have people that are being victimized every single day that are victims of crime at varying levels. And so it's important for us to recognize that that's our focus, that we serve victims. That's what we get into this game to do, is to serve the victims of our community. And so what I think, regardless of what happens, regardless of whether or not declaring of a state of emergency allows a city manager to do some special things in our community that we may be seeing around the country, and maybe more locally, Portland may be entertaining over the next 24 to 48 hours, is that there will not be any adjustment in our services, because we know that we have victims that need to be served. And we'll be out there. And so this is an important piece of good law enforcement and good 21st century policing, is that you don't have sheriff's deputies and Springfield officers and Eugene police officers just sitting around waiting to be called. You have them out in the community so they can be visible, so you can have a sense of comfort in knowing that we are trying to pay attention to the things that look a little off in your neighborhoods, things that may look a little suspicious, and we are tasked with engaging and being able to stand kind of in that harm's way, if you will, between victimization and the perpetration of that crime. And so I would just ensure everybody that's watching or listening that your law enforcement services, Lane County wide, will not be affected by any kind of city shutdown, regardless of where that happens.
Before you sit down, could you give us some examples of services that are probably going to be curtailed, so people can just get their mind around the fact that they'll be on the priority list?
Well, I appreciate the question, but I'm also going to give you a little bit of a backhanded answer to that. The last thing in the world I'm going to do is stand up here and tell you what we're not going to respond to. I'm not going to give up my operational and tactical position on that. But what I will tell you is as people call in and we have those good conversations at dispatch with our call takers, we're communicating that to individuals about how they may see a response that's a little bit different. I think sometimes we, in an effort to really communicate well with our community, we have a tendency to over-communicate the things that we are and aren't going to do. And it goes back to the comment that I made earlier. Unfortunately, we have people that are waiting to find out what it is we're not going to respond to, and then it shouldn't be a big shock that those are the ones that get most victimized. So, but the conversations are being had through dispatch. If you call in, you're going to know kind of what to expect from your law enforcement response, and we've been met with some high levels of understanding around that. And so, I appreciate the question, but I'm going to be a little bit careful about how I respond to that. So,
you know, it seems like you have not, from what you've indicated, seen an uptick in crime, but do you anticipate that with the level of anxiety that people are experiencing and the, you know, some people reacting to it different ways, that there might be an uptick?
Sure. Yeah, our call volume's been pretty steady, which intuitively you would think it goes down. If you've been driving around the town, it feels very, very quiet. Unfortunately, the criminal element and the criminal behavior and some of the bad behavior that we're asked to legislate is not quiet. We're seeing those calls. I would see as people get more anxious about what's going on, we would see them calling. The piece that I think is really important is to not have this sense that we're overwhelmed to the extent that you shouldn't call us. We still need to gather the data, especially during this time. So when I get asked the question, is crime down, I can honestly either say yes or no based on the fact that our call volume has been steady. If you quit calling law enforcement, then of course the crime is going to look like it's gone down, and it's an artificial number. And so we're going to ask our people to continue to call us. We may not get to the response as quickly as you'd like. It may be a different response based on the circumstance, but it helps us gather data so we can do really good analytics about where crime's occurring and where we need to put resources.
This definitely is a question for Eugene, Springfield, and Lane County. You guys have said there's no problem with staffing, it's not gone down, but has there been any sort of enhanced training in anticipation of a potential city or county shutdown or anything similar to that?
Well, I'm going to step away so I don't monopolize the microphone, and I'll let Chief Lewis answer this one.
Well, there's been no specific training, but we have an MOU between the agencies that we've had since I started here 37 years ago. And that MOU basically says that if one agency needs additional resources, the partner agency will bring those resources to bear. So if one agency had a big exposure where they lost a bunch of officers and they needed more resources, we would provide those resources, or they would provide it for us. So the agencies work really well together. And that's happened over a number of crises we've had over a number of years, and that'll continue to happen. I have no concern about that at all.
Before you sit down, so keeping a restaurant open is a Class C misdemeanor, I guess, at this point. How are the police going to respond to a report of something like that?
Well, you know, we're gonna have a major response, and that response is probably the first thing is just a phone call, and the phone call is probably going to come from OLCC or Oregon Health Authority. There's licensing involved. To give you an example, if you had a bar that decided they were going to have everybody come in and do that, OLCC can simply call and say, you won't want to lose your liquor license, continue what you're doing. And that's already happened somewhere in the state, and it was effective to get that taken care of. Beyond that, if that's not the case, you're going to use common sense when we go out there and realize this isn't the biggest thing. We're not out there to make criminals out of people or anything like that. And I don't have any concern that this is going to be an issue with people. The citizens of Springfield and Lane County have always reacted very well during situations like this, and I have no doubt that they're going to help us and not tie up our resources with things like that.
I was just going to add to what the chief was sharing on the previous question about the mutual aid responses that we have, and make sure that you all know there's lots of viewers who aren't in either one of the two big cities. So those conversations happen across the county. For example, we've had conversations with the chief of police in Cottage Grove. And so really countywide, we have that interagency cooperation and have for a long time. And it goes back to my previous conversation, which is just I really genuinely believe that Lane County's first responder network and community is phenomenal. And so all of them are internally driven to serve this community, and they're going to do what they need to.
I have a question for you, Sheriff. Have you seen an increase in gun licensing in the county?
No, not per se, actually. One of our services that we have seen an increase of is actually driven because other places have discontinued providing that service, which is just fingerprinting in general. Plenty of agencies generally provide that service, and as all agencies are evaluating their own ability to provide services, we actually saw yesterday some folks coming from out of county to the Lane County Sheriff's Office for some fingerprinting services. And so we're probably going to have to prioritize that. It goes back to, hey, would you give us a phone call first? So I don't want to shut down that service. I think there's some important work that still needs to go on. For example, sometimes folks need to get fingerprinted so that they can go provide services as a nurse. So we're obviously going to prioritize that sort of service, but we're just asking people to call us first so we can do that, prioritize it.
Before you sit down, can you expand a little bit about the jail situation? You talked a little bit about the protocols. That, for the record, has anybody been tested there and been shown positive? And then kind of recap what steps you've taken?
Yeah, you bet. So the first answer is no, nobody's tested positive or been tested. Really, we haven't had anybody display symptoms requiring that. We do occasionally have people come to jail that say, I have COVID, so you should release me. But we run those folks through proper medical screening and make appropriate decisions based on that. And I'm going to go back to the fact that we have 24/7 medical in our jail, which really, who among us have 24/7 medicals in our home? I mean, the fire chief, but the rest of us maybe not. So in a lot of ways, that's a pretty safe environment to be able to have a medical professional monitoring you, even if you are displaying some of the symptoms. So that's where we're at right now. We're not interested in pushing more work at the emergency departments, and there's really no need at this point because we've got a fully qualified medical professional that can do that screening. Thanks.
I know none of our speakers have touched the podium lately, but in an abundance of caution. So at this time, if there aren't any further questions for that community, all right, hearing none, I will go ahead and give a situational update. But before we start on that, I would like to just make it known that we have great mental health resources on our coronavirus website. Again, that's lanecountyor.gov/coronavirus. We know there's a high level of anxiety, worry in our community, and so we want to make sure that those resources are available for folks. There's some call-in resources there where people can call a number and get help. We also have some email-in resources, and I just think that's an important consideration. I would also like to take this opportunity to thank our ASL interpreter and the services that they've been providing. I think that's vital to make sure our message gets out there. Another part of that accessibility is that we're working really hard to get the Spanish language materials out to the Spanish language speaking community. We have an entire branch within our emergency response that is doing that to make sure that they're included on the conversation and have up-to-date information. And so with that, I can go on to the situational report. As of this morning, we had 126 tests administered here in Lane County with 13 pending. So those pending tests, we should receive results in a matter of days, and we'll make those numbers available. We are seeing a great demand for our testing numbers, and so those will be rolling in and updated at 10 a.m. every day and 3:30 p.m. We'll get those on the website as soon as possible so that people can be aware of what's going on. I have also received word that there is significant expansion happening in the testing capacity, especially at our private labs. The one in San Juan Capistrano has upped their testing capacity up to 10,000. That will significantly impact our ability to get tests processed in an expanded fashion, in an expedited fashion. You can imagine that testing is in demand everywhere, not just Lane County, not just Oregon, but certainly California, Washington. So as we start to clamor for our people to be tested, everyone else is at the same time. So just being aware of that demand. There's been some questions come in through our call center regarding drive-through testing and where we're at in that. So there's a lot of public health science that looks into whether or not drive-through testing truly is available. And the reason that we haven't instituted that up to this point, one is logistically. We have a large county. Some of the smaller counties have done this. We've seen it happen in Seattle effectively, but just logistically, we're still grappling with that and getting it in place. The other is the fact that we have short supplies. So as we start to make the testing more available through a drive-through resource, then we limit the supplies. The third reason would be because as we start to put these tests out there, we can increase the amount of tests or samples that are taken, but it doesn't necessarily increase the testing capacity. So what we do is we get even more of a bottleneck. And so all those were considerations, and now we will be hopefully announcing some definitive news in the next few days on that. But we have public health people who are behind that logistics piece and making that available for our community. Right now, we still are standing at 2 presumptive cases here in Lane County, both of which we've currently announced, and contact investigations are ongoing. In the process of those contact investigations, we have identified a situation which we need to alert the public about and let you know in an effort to be as transparent as possible. We're weighing this transparency piece with also patient privacy and the need to protect our people here in Lane County and their confidentiality. And so we had a significant discussion this morning. That's one of the reasons why we were late getting on to the press briefing today. There was a 4J employee who was a direct exposure to a known case. He then was not symptomatic, but reported to work on the 10th and the 11th. 4J is now following up with direct communication to parents of students who we believe to be potentially have contact with this person. Now, it's important to remember that this person has not tested positive for COVID-19 yet. So the children who were around this person are not necessarily considered an exposure. If he tested positive, given the public health definition of what an exposure is, so that is with 6 feet for an hour or more, he still would not be exposing the kids given the nature of the job. So as we move forward, 4J, like I mentioned, will be doing direct outreach with the parents. If parents are concerned, they can call our hotline 682-1380-1380. At that time, if they could state that they are a concerned 4J parent, that we will then triage them to one of our communicable disease nurses who will take that information. I can share with you that the parents who need to be concerned are limited to elementary and middle school age parents, and to the best of our knowledge right now, that number is around 240. Really underscoring, and please make this as explicit as possible in your reporting, that at this time we do not consider the children high risk to exposure. And even if this individual does test positive for COVID-19, they would still not be considered under the strict public health definition of being an exposure for COVID-19. Nevertheless, we understand what it's like to be a parent and to be concerned about your children. And so that's why we're announcing this, that's why we're making that information available, and that's why we're giving you the resource of being able to talk to a communicable disease nurse, talk through your concerns, be given the best health recommendations possible, and also resources that can help you as you think about how to take care of your child and your family. And at this time, I will take any questions.
Can you share which school?
I can't at this moment. Again, we are really working hard at balancing that very critical piece of patient privacy, and our need to be able to have our community feel safe and be proactive about communicating with us. Public health relies on open communication with our community and with people who may be exposed on a number of different communicable disease illnesses. And so we really try to make this information as public as possible and empower our community with good, timely information. However, we really have a vested interest in protecting the identity of some of these folks.
So if, just to recap, if a child was exposed, the parents have probably already been contacted. Did I hear that right, or that's still in the process?
So the question is, and I apologize for not restating the first question, the question is, have the parents already been contacted if their child was one of those that was around the exposure? So I believe that communication is going out directly from 4J school district officials this morning. I am not currently aware of the status. You probably saw me texting a lot before this conversation, so I'm trying to find as many of those details out for you. I know that that communication is forthcoming.
When you say that this individual has not tested positive, does that mean that their test is still pending?
That's a good question. Thank you, Rachel. So the question is, if the individual has been tested, is the testing still pending? So yes, this individual, as soon as we were aware that they were an exposure and given their employment, we tested them yesterday evening. Lane County Public Health facilitated that test in our parking lot with full PPE. So that test was collected and sent directly to the lab. We are expecting results shortly, and we will make those results known because that would obviously be a positive or negative, and we will certainly inform our community of those results.
Jason, so when you are considering social distancing, they're getting bored. That's not it's not news. But when they want to think of things to do, is traveling to the coast an option? Is traveling to these outdoor sort of recreational spaces where you're allowed more space from others, is that something that is an option, or is that recommended against?
So the question is traveling, I'm assuming by car, to some of our outdoor locations like the coast, maybe national parks, advisable or not advisable? That can be confusing. We see a lot of information out there about take advantage of your outdoor spaces. I know that the official CDC recommendation and the information that we're receiving from our governor is to limit unnecessary travel, and so what constitutes travel. And I would assume that in the effort to try to slow congestion and also keep things in a reasonable fashion, that we would not advise folks to take long car trips as part of that recommendation. That would be considered unnecessary travel. However, our outdoor spaces are safe places. So your parks, your sidewalks, all those spaces really are still considered safe places. There has been a question come in, and I think it's a very good point to mention about playground equipment. You know, kids are crawling around on the playground equipment. Those are considered high-touch surfaces, and I know that it's very difficult for parks to come out and actually use sanitizer on those equipment. That would deplete our supplies. It wouldn't be effective. And so at this time, really what we would encourage is using the open spaces that are not playground equipment. So things like the fields, kick a ball around, play catch, things like that. But the actual playground equipment is not, to my knowledge, being sanitized on an hour-by-hour basis or on the level where we would feel comfortable advising folks to use that playground equipment. I know this can be a hardship for parents. It's tough to find ways to entertain your kids during this time. But fortunately, we still have everything you have available in your home, and then just trying to be creative in those outdoor spaces. There's some really great resources I've seen, not necessarily from our website, but from some parenting websites. And we'll look into making that more accessible and available, creative ideas on how to keep your kids entertained and how to talk to them about COVID-19.
One of my final questions that I have is, can you prepare us for a reality that will exist a couple weeks from now if we are to follow every guideline that you guys have put in place strictly, and if we are to be negligent to those guidelines? What are some polarized realities that exist for us?
Well, first and foremost, I think it's really good to state that public health is not in these gentlemen's business. We don't enforce laws. We make recommendations, and we utilize our first responders and our law enforcement partners to help carry those out. And so I wouldn't be speaking about the enforcement component to your question. And just to reiterate, the question is kind of paint a picture of the reality a couple weeks from now. I think it's really hard for us to paint that picture, and I know that that might seem murky or maybe not transparent. It's not. It really is having to do with the fact that this situation, this disease, basically everything that's going on right now is unprecedented. And we are adapting as we go. That is the correct response, to adapt based on the needs that we see in our community. What's happening in Portland is not Eugene, Springfield area. It's not Lane County. So what we have to do is we have to see the situation on the ground, what the test numbers look like, what the case numbers look like, and act accordingly. So I think at this point it really would be conjecture. I think that we can expect to really double down on the message that our folks, we can plead with you to please do the social distancing. If we do that in a very concerted manner, then we can avoid some of those more extreme measures. Those extreme measures will only be made if our authorities and our decision makers and these people here do not see that general cooperation. So as a community, now is our time to adhere to those and then avoid those larger recommendations. Yes, Carrie.
Can we take a moment, if there aren't any other questions, for our first responder community to excuse them so they can go back to their offices and continue taking questions for you?
I think that's great, yeah.
Jason, I have just one more question for you. When it comes to the information you cannot share about this exposed person in 4J,
Sure.
are you taking recommendations and advice from the district of information you cannot share? Are they taking advice and recommendations from you, or how is that working?
It is a mutual process. So I can tell you right now that the public health recommendation on a situation like this would be that these children are not considered exposures. So we would not make the public announcement, typically, nor would we necessarily need to contact all the parents. But our partners at 4J understand the needs of the parents they serve. They understand the needs of the information, and they also can track the rumor mill that's going around. We've certainly heard those calls come into our call center. And so we've worked with 4J on a mutually amenable or agreeable response that can take into account the needs of both agencies and the needs of our parents and our community. And I apologize, I didn't restate the question that KZI just asked. The question was, is this a public health decision about the information shared, or is it a 4J decision? And so the answer, of course, is both. Any other questions? Thank you, and we will be taking up our virtual press briefings starting tomorrow.
All right, just moments ago, it wrapped up that press conference with the Lane County Health Department. The breaking news coming out towards the end of that press conference. A few minutes ago, we just learned that a 4J school employee has been tested for the coronavirus. Jason Davis, the Lane County PIO for the Health Department, said that that employee had direct contact with a current COVID-19 case, and he says that that employee's COVID-19 test is still pending. He said that elementary and middle school students who had direct contact with this 4J employee aren't considered high risk for contracting the coronavirus themselves, but obviously this is unnerving news for a lot of parents and potentially other employees out there. We're going to break down all the information coming up in a live report with reporter Emma Jerome. Don't go away. We'll be right back.